everyone. Good morning to all of you today, and welcome to the Youth Global Health and Innovation Conference. This is the first day, and I'm really excited to welcome you all here today. I'm Meher Graywall. I'm a high school student at Interlake High School in Bellevue, Washington, and I'm also the director for Worth a Shot, which is a global health organization working towards bridging healthcare inequities. Greetings from the Pacific Northwest. I know it's a nice rainy day we're having here, and greetings from the Emerald City, Seattle. So we're really excited to meet you all. All of you make this conference truly global. We have people here today from all around the world, and you represent so many different countries of the world. So it is great to know that the love of global health, innovation, and medicine brings us all together today. So we are fortunate to have distinguished speakers who are eminent leaders in their fields and are graciously giving us time today, as well as helping inspire the next generation of researchers and scientists who are all of you. So before we get started, I just want to take a minute to acknowledge our sponsors, Aristo Health and Atlas Physical Therapy, for making this conference possible today. So I would like our team to please introduce themselves. I will start with Brian.
Hi, everyone. My name's Brian. I use he, him pronouns. I am a second-year medical student at the University of Washington School of Medicine here in Seattle.
Thank you, Brian. Now hand it over to Annika.
Hi, everyone. My name is Annika. I'm a recent graduate from the University of Washington. And I'll be hopefully pursuing a PhD and MD program relatively soon. I'm really looking forward to chatting with you all today.
Thank you, Annika. Now hand it off to Antonio. Antonio, we can't hear you.
Can you hear me now?
Mm-hmm.
Hi, my name's Antonio. I am a fourth-year medical student at the University of Washington.
Thank you, Antonio. Now I'll hand it off to Louise.
Hi, everyone. My name is Louise. I'm a junior at Henry M. Jackson High School in Everett. I'm the head of communications and director of South America operations for Worth a Shot. I'm really passionate about bridging socioeconomic gaps in healthcare and promoting mental health awareness. I'm very honored to be one of our hosts in this year's conference. Thank you.
Thank you, Louise. And now finally, I'll hand it off to Chris.
Hi all, I'm Chris. I'm also a fourth-year medical student at the UW.
Thank you, Chris. So I'm now honored to introduce our first speakers. Dr. Carey Farquhar is a professor at the University of Washington in the departments of global health, medicine, and epidemiology. Dr. Farquhar is also the vice dean for education in the School of Public Health at the University of Washington and the interim chair for global health at UW. Dr. Farquhar is also director of the UW Kenya Research and Training Center and the International AIDS Research and Training Program. And Dr. Sarah Masyuko is the lead of the HIV testing services and pre-exposure prophylaxis program at the National AIDS and STI Control Program with the Kenyan Ministry of Health. Dr. Masyuko is also a recipient of the Department of Global Health Graduate School Fund for Excellence and Innovation Top Scholar Award. Dr. Farquhar and Dr. Masyuko, it's an honor to have you at this conference. Thank you so much for joining us today, and over to you.
Yeah, thank you so much for that introduction. And let me just start by saying how pleased I am to be here with my colleague, Sarah Masyuko, to share with you a few thoughts about conducting global health work, and also just really pleased to be joining you in your launch of this conference, which looks like it'll be absolutely phenomenal. So before I begin, let me thank the organizers. It seems you've done a really tremendous job. I appreciate your inviting us and allowing us this opportunity to share our perspectives. I am going to go ahead and share my slides. Here we go. They should be going into presenter mode shortly. There we go. So what I'd like to talk about is partnering to conduct research that impacts policy and practice. And what I'm going to start with is really talking about working in global health. What is it? What isn't it? Why are we working in global health? And how should we be doing global health work, which I think is really important as you kind of launch your conference for people to have a good foundation in this area. In part, this will really allow me to talk about what I'm most passionate about, which is capacity building in the Global South and equitable partnerships. And over the nearly over 2 decades that I've been working in global health, this has certainly come about as being most important to me. I'll then pass on to Dr. Masyuko, and she'll speak more about her passion, which is really translating research into policy and practice, and also use an example from Kenya. So let's start by thinking about what is global health. So global health is difficult to define, and this may not be a perfect definition, but it's I want you to think about it as both kind of research and practice in a global setting. It's not just public health or medicine in another part of the world. And one reason for that is that it has as a priority to achieve health equity. It requires really highly interdisciplinary and inclusive teamwork. And there's a strong focus on sustainability and resource considerations, because often we're working in resource limited settings. Partnerships are absolutely essential here, but they're often inequitable. We'll talk more about that. Problems also cross borders, so they're not restricted to a local setting. And this gives me an opportunity to just briefly mention 2 really critical areas of health, which were not on my radar when I first started doing research and practice. So one is climate change, and I think you'll have these slides so you can spend a little more time with them later. Let me just emphasize that climate change is clearly something that affects health and needs to be high on everyone's list of priorities. And the other is non-communicable diseases. As you can see from this slide, cardiovascular disease has moved in the last 25 or so years into the first position in terms of causes of death and disability, whereas some of the other communicable, maternal, neonatal, nutritional diseases have moved lower. Neoplasms up there at number 5, and other non-communicable chronic respiratory diseases. So keep that in mind as we kind of think about global health work. So why do we work in global health? This might be a little easier than the actual definition of global health, at least for me it is. There are really super intriguing problems that are in need of solutions. We have the opportunity when working in a global health setting to have an impact, really make a difference. There is the opportunity to also to interact with other cultures, which I think many of us find very fulfilling. And then, of course, there's to the adventure, the excitement of traveling to new places and new environments. But as you think about the why, I also want you to appreciate that there are caveats to this, and the ends don't justify the means. So if just because one is kind of idealistic and well-intentioned, that doesn't mean that you can ignore how you go about doing your work. So that's one. And then the second is to realize that your colleagues in the Global South, where you might be doing your global health work, also are inspired to do global health for the same reasons. And they have a right to travel. They have a right to experience the world, so just as you're doing. They really deserve to have the life-changing experiences. In many ways, even more than some of us might. And so I would just charge you all to really work hard and persevere to help make any exchange that you're involved in a bilateral exchange, and make it equitable, and just really push to make it happen at all. I think there are too many examples of students, our students at University of Washington, fellows, faculty going to other places and not make it for a variety of reasons, because there certainly are barriers, not making it possible for our colleagues and fellow students, peers to come here. So let me go on to the how, which I think is probably most important. Above and beyond when we're working in global health, we need to strive to have equitable partnerships. And there's a lot of literature around this. I would invite you to take a look at this one article by David Citron in Global Health Action, where he outlines some of his work in Nepal, trying to build a collaborative research program. And I would also say when you're doing global health work, you absolutely need to involve the community. You should be working alongside community members and your colleagues from the Global South. And it will take a lot of listening, a lot of patience, and humility going into this. So I'm going to end with a sort of quick case study because I want to leave Dr. Masyuko enough time. In Kenya, for the last 30 years or so, we have had a Kenya Research Training Center and collaborative research programs that have involved a large number of individuals. And you can see many of the students, fellows, faculty, both from University of Washington and from all of our Kenyan institutions here in this picture from a retreat in Mombasa. So one thing that actually made this Kenya Research Training Center a success, though, is that for about the same amount of time, we have been working hard to get funding from the US National Institutes of Health to train Kenyans. So to allow Kenyans the same opportunities, have them coming to University of Washington, earning master's in public health degrees, master's in biostatistics degrees, and doctoral degrees. The majority of these degrees have been at University of Washington, but we've also been supporting degree training in Kenya. Over this period, though, we've also changed our approach, and we've done this in a number of ways to make the experience more effective and also more equitable. We've moved from training individuals and having that as the focus to really focusing on institutional capacity building. So focusing on training a larger number of individuals from the same institution to build capacity, as opposed to training individuals all over the globe or all over the country, if we're just thinking about Kenya. While there's been an academic focus and that persists, we've shifted to also focus on training people in county and national ministries of health. So the county government, national ministries of health, and Dr. Masyuko is an example of someone who comes from the Ministry of Health and has now gotten her MPH and PhD at University of Washington and continues to work in Nairobi with the Ministry of Health. Our training has also shifted from being primarily in Seattle to being both in Seattle and in Nairobi at the University of Nairobi. And with this next cycle, we're actually going to be shifting the funding over from the University of Washington, shifting it to our Kenyan colleagues. And this kind of goes along with us expanding from having just a US University of Washington principal investigator to having multiple principal investigators that include our Kenyan colleagues in the leadership and the management of those funds. And this is kind of the result of those efforts. This is a picture from last week. I was in Nairobi on Friday. We held a meeting of my research team. We had individuals from Ministry of Health, from county governments as well. And these are the individuals sort of on the ground that are making it happen. They're taking the research that we've all done together and improving health, making health more equitable in Kenya by getting the results of that research to the people. And I'm sharing this photo sort of in contrast to the first one because this is really what it looks like to decolonize our work. And if you haven't sort of heard that word decolonizing global health before, I think you will be hearing it quite a bit. And to me, all I can hope for is that we have more successful programs like this one that end in meetings like this one, although this is definitely not the end. So let me stop there. I will allow Sarah Masyuko to continue, and I can advance the slides for you, Sarah, if you just want to let me know. So thank you.
Thank you so much. So this is a beautiful picture of Lake Nakuru. So this is a lake, and I think Carey really likes this picture, and it's just showing you part of Kenya and how it looks like, and it's really a beautiful place. We can go to the next slide. So just as Carey has introduced herself, and I just want to say thank you for inviting myself and Dr. Farquhar to present today. It's really an honor, and I have a passion for young people because currently adolescent and young people's program too. And when I see this, I'm really happy and passionate. So I have two great passions, many, but I will talk about two today: young people, and the second one is around policy and practice. So how does research actually impact policy and practice? So I think about maybe if you could go back to the slide before that. So this is a phrase that you hear in the HIV field, that nothing without us. Nothing about us without us, meaning that in everything you do, you involve young people. And Dr. Tedros, who's WHO Director General, said that young people are the greatest resources for societies to thrive, and encourage more countries to invest in improving the health of young people and engaging them in decision-making processes and initiatives to achieve health for all. So I put this here to just say that you as young and as old as you are, then you can be able to still impact policy and practice in your work and in your research. So in terms of impacting policy and practice, really there are four key things that I would like to talk about, and I'll give an example. One is you really do need to know the issue that you're trying to address. If you're working in research or global health, you have to understand what is the problem. So putting efforts to understand the problem and then coming up with a solution which is innovative, but also considering its implementation and feasibility of implementation. How much does it cost? How are you going to be able to implement it and put it to scale? So for us, we look at scale. Like, and when we talk about scale, I'm thinking about something that is used at a national level. Also, you have to know who to engage with. Like, it's very critical for you to know when you go out and you go out to the field, either as a Peace Corps or whichever program that you do go, and in a training program, how do you engage with the people? Who do you engage with, and how do you engage with? Dr. Farquhar talked about communities, and they are really important for you to engage, including also policymakers as you're going along. And then building partnership, and I'll talk a little bit about that next. So I want to really begin with a local partnership. We chose this case study. It is not about HIV, which is what we work in a lot, or NCDs with Dr. Farquhar, but it's about vaccines and vaccine preventable diseases. And I think you all relate to that. That vaccine preventable disease is actually a global health threat. When you have an outbreak, for example, of measles or smallpox or something else, or now COVID, you do need a vaccine to deal with that. So I'll give you a story of a young innovator, and you can see her there, and she's carrying her innovation. She is Nora Magero. So Nora Magero is a young mechanical engineer who co-developed the VaxiBox. What you see there is called the VaxiBox. It's a portable solar-powered fridge that can safely store and transport temperature-sensitive medicines, such as vaccines, that are to be used by clinics. She got this idea when she had, from her life experiences, she was pregnant, she gave birth, and she needed to access vaccines for her child, but she was not able to do so because she was living in a rural area in Kenya. And because of this, her innovation, she then got actually awarded the 2022 Africa Prize for Engineering Innovation Interactive Showcase. And she's the first Kenyan in 8 years to get it, and the second woman to ever get this award. So just showing that it's really local and living from her experiences. So if you got it, that she was living in a rural area, experiencing a problem. So it's the same thing in global health. You see a problem, you indulge in the problem, you understand the problem, and then come up with a solution. So very, very important that you take time to understand the problem. And that means that you might need to embed yourself in the community to understand really what the problem is. Next. So what is a problem? So this I have copied directly from what she did present, and this is from you can find it in the next slide. I'll show you in the drop access, and you can read about her story. But what she did say as a problem was 50% of annual vaccine produced gets spoiled due to cold chain gaps. Most of the children each year die or suffer from vaccine preventable diseases. And there are maternal deaths in Africa, which are due to unavailability of blood that is used for transfusion. And we need so many fridges for primary healthcare in sub-Saharan Africa. And 1.2 billion Africans are yet to receive a COVID vaccine. So some positioning really what is the problem here that she's trying to address. Next. So what is the solution then to address this problem? Is she came up with this portable IoT-enabled solar vaccine fridge, which is called the VaxiBox. It is locally manufactured in Kenya. It is portable, meaning that you can be able to go to any geographical area and go for door-to-door campaigns. It's embedded with a data monitoring capability, and she's able to monitor temperature, monitor stocks, and other things. It's also solar powered, so it is it's environmentally friendly, and you can also have it's easy to install and operate within a 24-hour manufacturer support. So when she did this, she partnered with engineers, mechanical, automation and electronic engineers, and also some health experts, including software experts. So the key takeaway here is when you are working in global health, you do not work alone. You always partner with others, and there are other resources that you can get, maybe a qualitative expert, an anthropologist, or somebody else who can work with you. Next. So how do you implement your solution to make impact? So this is, you can see this, she partnered with a county called Makueni County to actually provide this to healthcare workers. They put it on a bicycle, and they're able to take it to all the places that they do need to vaccinate children. So they partnered with governments, partnered with private sector. And right now she is seeking partnership with WHO, the World Health Organization, for WHO pre-qualification for this product so that it can be used globally. Next. So the key takeaways, and this is my last slide, is really as you think about working in global health, you need to gain a deep understanding of the problem, immerse yourself in the setting, in the culture, and in the context. Think about innovation, but also think about feasibility and cost, and also build partnerships as you're doing it. Build partnership with others, build partnership locally where you will be working, and also internationally. So I really want to encourage you that as you work in global health, think about policy and practice and how you can be able to make impact. Thank you so much, and I welcome your questions and your feedback.
Wow, thank you so much, Dr. Farquhar and Dr. Masyuko, for this amazing and inspiring talk. And thank you also for sharing your work. This is a really incredible learning experience for all of us. And we have time for a few questions from the chat. So please feel free to post your questions if you have any.
So one of the questions from the chat is, for both of you, is do the doctors Carey and Sarah have any special memories or experience that inspire them to work so passionately with global health?
Yeah, I guess I could start, and then Sarah, you could jump in. And I think for me, my interest in global health came as, well, first I was very interested in health, and then as an undergrad, I was also interested in African studies. Honestly, that's what I was studying as an undergrad. So my first really, I think, formative experience was going to West Africa for a 10-week period with an organization, a volunteer organization, and not doing anything health related. I was an undergrad at the time, but at the same time, being aware all around me of opportunities and ways in which to engage with people around a health in a health kind of a way. I was not a doctor at the time, but I was definitely knew I was going to medical school, and yeah, I think I don't think this is an uncommon story. I've actually heard it a lot. That you go to a place and then you kind of fall in love with the people, and then you want to just keep going back. And so for me, like West Africa was that place. Although Sarah's like, how did you end up in Kenya? Later in my undergrad, I ended up doing a semester abroad, and West Africa was not an option. So I ended up in Kenya. And ever since, I've been going to Kenya to do research, say as a medical student, and then as an infectious disease fellow. And so I'll just end by saying, I think one thing that strengthens any global health work you do and keeps that passion alive is that human connection. And a way to ensure that it's there is by going back to the same places, interacting with the same people. When I go to Kenya, it's for my work, but it's also because I enjoy the social time with the people I'm with. And I was just in Kenya. I spent Sunday morning with Sarah and her new puppy and daughter. And that was just as enjoyable as talking about our work, although we end up doing a lot of both. So Sarah, over to you.
Yeah, thank you. And I think, Farquhar, you really bring up the issue. For me, I think it's just the human. What drives me is people and the need when you look at the problem. Like for me, I worked when I was young. I studied with some people who live in some children who lived in an informal settlement. And I saw poverty, I saw malnutrition, and I said, wow, I do need to work on this. So I'm really driven by the problems that I see around me, and I really want to make that change. So that thing about people and putting people at the center of global health is really like key for me, and getting to work with great mentors and other people from other parts of the world really motivates me. And Dr. Farquhar has been my mentor for like 15 years now. Is it 10 years? Yeah, 10 years or so. So it's been really great to work with and collaborate.
Thank you, Dr. Farquhar and Dr. Masyuko. So another question we have from the chat is, how does the COVID pandemic change the perception of global health?
Mm-hmm. Yeah, so I'm obviously based in Seattle, and I do a lot with medical more with residents, fellows, and faculty. And unfortunately, as you all know, during the pandemic, we weren't able to travel. And honestly, what I've seen is a kind of waning of interest in global health. And this is why this conference is super inspiring for me, because clearly there's a segment of the young population that's still interested in global health. But we have, I think because people applied for things and then got their hopes up and then were denied, and multiple times people planned and then weren't able to travel. I'm not seeing as much interest in the internal medicine residents and some of the other residents. So that's maybe sort of on the negative side. I think on the positive side, I think it really has exposed the inequities of systems, international systems, and frankly, how nations are so selfish when it comes to something like vaccines, that we all realize that if the world had access to vaccines, we'd all be a lot safer, because these are not, as I said, these are global health problems. They cross borders. Just vaccinating everyone in the US does not, with 3 or 4 vaccines, doesn't necessarily make us as safe, as it would if there were more equitable distribution. So I think those are 2 comments. I'm going to pass to Sarah to give her an opportunity as well.
Thanks. I'll just add one more, which is positive, is around innovation. I think because of COVID, we've seen a lot of innovation as well, not only in terms of global health, but also in terms of just everybody needs to respond and to make a change. Even in policy and in practice, we just had to quickly change. Like, you can't be able to offer HIV testing, you can't go out. So we are having to give people to do a self-test. So really thinking about innovation and how we had to be innovative in solutions to deal with the epidemic has been really a challenge. And for us.
Okay, thank you so much, Dr. Farquhar and Dr. Masyuko. I think that's all the time we have for questions. And We're so grateful for your time today. Your talk sets the stage for an exciting global health experience for all of us. And thank you so much for joining us.
Great. Well, thank you for having us.
Thank
Good
you.
luck on the
Thank
rest
you.
of the conference. Take care.
Thank you. So one thing that I want to let everyone know before we move on to the next talk is that feel free to turn on closed captions if you need it. We've enabled it, so you can just click on the button that says live transcript, and that will turn it on for you. So we just wanted to let everyone know about that.